Walking. Many of us take this simple act of walking for granted. Some of us, however, like our patient for this story, Wanda Bush, rely on walking in order to be able to perform a job.
I work for the state of Michigan, and I am going from one housing development to the other for federally regulated site visits and inspections.
When Wanda began experiencing a degree of foot pain that made the simple act of walking and working difficult, she sought help from the DMC.
My mom is a retired nurse from the DMC, and she told me that Dr. Kissel was the best podiatrist in the city of Detroit, and that's who I should go to.
What I would tell people is never to ignore pain in their feet. Sometimes people think, oh, my feet are supposed to hurt, I've been on them all day, or my feet are supposed to hurt, I played football. No, your feet are not supposed to hurt.
Wanda knew from experience that she did not have to continue being in pain. She already had one successful bunionectomy at the DMC and suspected it was time for another.
The same pain that I was feeling in the right foot, I started experiencing in the left foot. Couldn't wear certain shoes. You can't, sometimes house slippers will aggravate the foot.
As the chief of podiatric surgery for the Detroit Medical Center, Dr. Charles Kissel uses pain levels as one of the determining factors for surgery.
And we really try to get people to understand that if it's cosmetic, it should be left alone. And if it's painful and starts to bother their function, then it should be addressed surgically.
In Wanda's case, it was becoming clear to Dr. Kissel that she would need a second bunionectomy to relieve her foot pain and get her back to work.
A bunion is an enlargement of the great toe joint. The most typical type of a bunion occurs at this metatarsal phalangeal joint in the foot, same joint we have on our thumb. And it happens when the bone starts to slip out of the socket, big toe goes over toward the second toe, and this knuckle starts to project because the ligaments on the side are no longer holding it in place. So the ligaments on the side start to stretch, the joint starts to buckle and starts to pop out of the joint. Over a period of time, as this bone is being moved up and down in this malposition, it'll start to wear on the cartilage and damage the cartilage in that joint.
In the operating room, Dr. Kissel prepares for Wanda's second podiatric surgery.
The ligaments on this side of the toe stretched out. Normally they were holding the toe over like that and preventing this bulging. And as these ligaments weakened, the bone started to bulge out the side. This whole line here and right around here, that's what started to cause her pain, is the cartilage starting to get worn away.
Dr. Kissel and his team cut and reposition Wanda's metatarsal bone. Then they rotate the damaged cartilage before applying 2 microscopic screws into the bone.
So these little screws hold the bone together really tight. So there's no wiggling. That prevents a lot of the swelling that we used to see and makes the bone heal a bit quicker. So we've accomplished what we want. We're sure of it.
Is this a before and after?
Uh-huh. In this picture, we've pushed the bone over and we've twisted this piece. You can see how it sticks out over here because of the twisting, so that the raw cartilage is now not going to rub against the other bone.
The before and after for Wanda Bush and her day-to-day life is also remarkable. With a relatively short recovery time and very little post-op pain, her second bunionectomy at the Detroit Medical Center was also a success.
In terms of the quality of life, the before and the after, I had intermittent pain. Now I don't have the pain. I can wear a different type of shoe that I wasn't able to wear prior to the surgery. So I'm very happy that everything went well and that I'm back to normal.
According to Dr. Kissel, recovery time for bunionectomies is very short. Nearly all patients are extremely satisfied, and once a bunionectomy is healed, it's permanent. I'm Emory King.